Dr. Aziza has been present with me in clinic, investigations, and in the OR. What was your experience with this?
Okay, I've had a very good experience doing my glaucoma training with Dr. Isham. In the clinics, there were a wide array of cases to learn from, how to take important clinical decisions to determine what kind of treatment would work for a particular patient. In the sense that I learned how to individualize treatments. Treatment for Mr. A is not necessarily going to work for Mr. B. I also had the opportunity to have access to a wide array of investigative tools that help to aid the diagnosis and treatment of this patient, such as the use of optical coherence tomography and OCTA. Also in the OR, there was a lot to learn from in terms of the array of surgical procedures that were available, such as learning about glaucoma drainage device surgeries, learning about deep sclerectomy, learning about combination surgeries like phacotrabeculectomy, phaco-deep sclerectomy, also learning about phacoemulsification itself. I also learned about minimally invasive surgeries such as gonioscopy, assisted transluminal trabeculectomy. So much that and so many more were the things I was able to learn. I also did learn from Dr. Isham how to be calm, even in the face of difficulties, even in the middle of a surgery, you're having challenges. You still make sure that you give it your best shot and that the patient has a good outcome. So that at the end of the day, I can say that I have learned how to deliver quality eye care service to any patient in any way possible. But at the end of the day, the most important thing is to ensure that the patient has the best care and has a good outcome.
Did you see this? Some challenging cases, some difficult cases, and you can define for us some of that.
Yeah, I think there were some challenging cases that I learned from, but I think for me the most challenging that I feel was a bit challenging was the deep sclerectomy. I practiced trabeculectomy back at home, but I realized that there's another level of skill that comes with practicing deep sclerectomy, because I think it's just a fine line between, being able to deroof the trabecular meshwork properly without causing any further challenges. And I think that I've been privileged to witness a particular case where it was a combination surgery. It was a phaco deep sclerectomy. And I think that even right there at the surgery, there was a learning point as to, okay, how far should we have gone with the deep sclerectomy before completing the phacoemulsification, and being able to handle that challenge at that sitting to ensure that the patient still had a good outcome.
And one thing that emphasized on is that the gentleman E decision with him will be different totally from gentleman P. Every patient will have a specific decision, even both may have glaucoma. There are more than 10 glaucoma surgeries that we can plan our treatment for each of the patients. You have seen with us glaucoma in children, in infants, glaucoma in adults, glaucoma after some other surgeries like PKP, like after corneal transplants. It was very pleasure to have you with us here in Onward Hospital. And with me, the main issue is to pass knowledge. We all are professors in universities, and one of our aims is to pass knowledge even in Egypt, in Egyptian doctors, and in non-Egyptian doctors all over the world. We both are Africans. We both somewhat we are brothers and sisters, and hoping that you will pass your knowledge, all you have learned in your country, serving your patients when you come back.
Thank you very much. I think I must say that I want to talk about Dr. Isham as a person, as a teacher. I think that I can say I am happy to say that I have gotten a mentor. in his patience, his dedication to answer all my questions, in his dedication to explain to me the skills, the procedures, even when I don't understand some of them, in his patience in interacting with me as a trainee. And I'm very grateful for that. I think that it is a great privilege. And I would like to say that if you ever find yourself having the opportunity to be here, to train under Dr. Isham, I think it would be a great opportunity. And I must say that this journey has been a journey of growth, personally, professionally, and indeed, I look forward to going back home and implementing all of the new insights I have into glaucoma care into my own practice back home.
Thank you. You are the hospital. We are the only hospital that is privileged to have the fellowship, international fellowships through the International Ophthalmology Foundation in Egypt. I'm privileged to be the only glaucoma consultant in the fellowship and the cornea consultant in the cornea transplantation fellowship. And thank you for being with us. Hoping to see you ever again.
Inshallah. Thank you.